All right, hello and welcome to everyone that is on the webinar right now. I want to thank you so much for joining our first virtual meetup session. This is all about telemedicine and virtual care best practices. My name is Jen Drummond, and I am a proud Jane ambassador and founder of Hummingbird Clinical Consulting, and I will be your host for this session today. I just wanted to take a moment to talk about the fact that this is not like a regular webinar. This was really created to build community of forward-thinking providers and teams. I was noticing just while working with so many different disciplines, there was one common factor, and that was many of those providers or their team members were really feeling isolated and lonely in their practices. And so I wanted to do something to change that. So these virtual meetup sessions will do just that. We're going to be building community and collaboration online while learning and leveraging the expertise of our expert guest speaker every single month. So thank you so much for being a part of this journey with me. And I hope that everyone on the call today finds this session super informative and gives you a sense of community and collaboration as well. So before we get started, just a few quick housekeeping items. Please keep yourself on mute during the presentation just to avoid any background noise. Once we move into the discussion and Q&A portion, you can feel free to unmute yourself and join the conversation, or you can use the chat box at any time as well. And last but not least, the session is being recorded and we will share the replay afterwards for your review. All righty. So we are so thrilled to have Catherine Esquer today with us. Catherine is a leading telehealth expert who has helped providers across the country optimize their virtual care strategies. Catherine, welcome.
Thank you, Jen. I'm also a very proud Jane ambassador myself, and I am thrilled to be here to share my insights as a practicing psychologist and leader of a therapist community that has navigated March of 2020 and beyond with telehealth and what we've learned throughout the journey. So, are we ready to dig in, Jen?
Yeah, we're ready.
All right. So, telehealth, 5 years later. I'm grateful to be here. For those of you who don't know me, I'm Catherine Esquer. I am a psychologist. Like I mentioned, I also founded the Therapist Network that came out of the pandemic for many of the same reasons Jen created this meetup here today. Because when we hit that the virtual wall, as I like to refer to it as, we had to convert not only our clients and our practices, but also our communities online too. And the Therapist Network was born out of that. We are a community of therapists who like to work smarter, not harder together so that we can build sustainable careers while thriving in our lives all around, not just at work. So, thank you for having me here today, Jane and Jen. And I would like to encourage everyone here and watching the replay to think back about the moment everything changed. I'm sure you can remember where you were in March of 2020. It's a pretty pivotal moment for a lot of our careers or lives per se. It was that overnight transition where we had to take all of our clients, our practices, and not only adjust to living in a pandemic, but completely change how we served our communities and how we served our clients. We were scrambling to set up tech platforms. I believe at some point I used a FaceTime for a call. We were trying to figure out HIPAA compliance, and everyone was really scrambling together. It was not only chaotic, but it was also a moment of unity. We were all kind of on the same page. We were asking, will insurance pay for this? I remember in my office, I had a sheet on the bulletin board with all the codes of what insurance would and would not pay for on each insurances. We were all trying to make it through. But despite these struggles, one thing came through pretty clearly, and that was telehealth wasn't so bad. Prior to the pandemic, telehealth was not an integrated piece of many of our practices. In fact, I come from the psychological field, so it was actually quite looked down upon as a less than intervention. But over the past 5 years, we're going to explore what we've learned and what's come out of this abrupt transition to telehealth and maybe where we can take it next. Because one thing's for sure is it's here to stay, and there's a lot of benefit to it. But where we go next is up to us as practitioners, and it's kind of an exciting place to be. So now that the dust has settled, let's check out the current landscape. So, if you're like me, you have been following all of the research coming out of the pandemic and coming out of the virtual healthcare paradigm shift. And what the latest research is showing is that 78% of therapists, those people, my people who were actually very anti telehealth because of that in person connection and energy exchange, 78% of us are still going to use it as part of our practice. And 58% of clients actually prefer telehealth over in-person sessions because of the convenience. And more so, this is mainly being driven by that Gen Z population and the millennials who are so used to connecting online that often, in fact, over half, 65% of them choose telehealth services rather than the in-person services. And that's a big number because that is where our healthcare is going. This is the future. These are the generations coming up behind us. These are the future practitioners, if you will. So the current landscape is telehealth is here, but we still have some bugs to work out. We still have some trust issues to work through, and we also have some new emerging technologies to integrate. So let's look at the demographic differences really quick. Like I mentioned earlier, Gen Z, they are the highest adopters of telehealth. These are the folks that have been on TikTok, been online, they have been making friends, they have been dating online this whole time. And it's not that big of a jump for them to switch to telehealth services. And as more of that population comes into the decision-making healthcare or healthcare decision-making roles, telehealth's going to become a much bigger role as well. Um, Additionally, Gen X, those of us who are in Gen X, or actually, I'm still a late millennial, but Gen X, these are the folks that were adopting telehealth maybe at work or in some ancillary areas. And they're the ones who are okay, yeah, they'll opt for it, they'll do telehealth. But they might not choose it as their first go-to because they are so used to the in-person. They grew up with the in-person medical model, and it's not something that comes, it's not an easy switch, right? We have that level of trust with our providers and a level of trust in our sessions and our healthcare, and going online, it kind of puts a little barrier in between that. That's what the therapists were pointing out so many years ago, that screen, it is a barrier, and we do have to acknowledge that. So when working with the Gen X population, it's important to note that these folks might readily adapt to it, but they might not come forward with some of their questions or concerns, or perhaps issues with the platform. So it's really up to the providers with the Gen X to check in and to see how they're feeling about the telehealth, to check in and see, is this inappropriate? Are you feeling connected? Do you have a stable connection? Do you have privacy concerns? Or would this be better suited? So it's important to keep in note that these are all personalized for the populations I'm talking about, but again, they could overlap. And last but not least, the most resistant, I shouldn't say resistant, I don't like that word, the less familiar folks with telehealth, those older adults. What we have found with them is that they are pretty resistant. I'm going to use it again, resistant to telehealth because it's not something that they quite even use in their professional life or personal life. I'm sure we have you can relate to some family members, maybe in your own household, who might not have a cell phone or just recently got an email or something like that. These folks are most at risk for not using telehealth. And that's actually quite important to note because research out of 2021 came back and showing that older adults actually had a higher satisfaction with medical providers when they have reliable tech. So as long as you can get that tech platform set up, either with in-home caregivers, Any neighbors, I've had neighbors go over and help my clients set up tech. If you can help them set up that tech so it's reliable and stable and trustworthy, then those folks are not going to have a problem logging in and connecting with you and receiving your services via telehealth. So we're really finding that emphasizing the usability and helping them set up and helping them become uh, comfortable, maybe not proficient, but comfortable with the platform and to know where to go for help if they have issues with the platform. That's going to be your biggest success with these older adults. So we're finding that different ages and different populations, they're adapting to telehealth much differently. And they do that because we are building rapport differently online too. This, again, coming out of the mental health field, was a lot of research into how can we continue to build the rapport in the telehealth sessions so that it is the same, if not better, than the relationship we could build sitting one-on-one with someone. And we know that this is important because strong rapport remains one of the biggest predictors of outcome success across healthcare disciplines, not just mental health. And this isn't just when a screen is involved. It's related to your rapport, your relationship with your client is related to adherence, client satisfaction, clinical outcomes. There's decrease of uh, litigation. Also, there's research that shows that. Um, we have to adjust because it's not the same as building a relationship one-on-one in person. So there are some things that we've learned over the past 5 years that are important to note. One is eye contact and on-screen presence. Clients and patients interpret attentiveness via visual cues. So these visual settings, in visual settings, one-on-one, we have a lot more to go with, but a screen, you only have my little box, right? So the client perceived provider attentiveness significantly predicted satisfaction in their medical treatments. So that just goes to show that this eye contact that we can replicate online is actually very important. And that there are certain ways that we've learned how to do it. You might be familiar with them already. One is to put your camera at the top of your screen and put the person you're looking at right next to your camera so that you can shift focus to the person you're looking at without having to shift focus across the screen, or give the client on the other side of the screen an indication that maybe you're not paying attention when in fact you're just looking at their photo across the screen. Another tip is to use practice sessions. This was done a lot in graduate school, and we actually recommend that providers still do this as a touch base to make sure that they're brushing up on their interpersonal telehealth skills, because interpersonal in-person skills are a little different. So get a buddy and practice an intake or practice meeting for the first time, and make sure you're running through all the glitches and all the little hiccups that could prevent a client from feeling connected with you. We also want to talk about naming the fact that it's a little different to look into a camera versus looking into someone else's eyes. And so by just stating, hey, the eye contact might feel a little different, or I'm going to look over here to type on my notes now, but I'm still listening. Just by naming that your visual tracking is changing and noting what you're doing with it is bringing that into the room so that the client can actually understand that and still feels connected to you, even though your gaze is at a different position. So this gaze is actually starting something that we want to continue, and that is the emotionally connecting with the client to provide that safety and that relationship. Session structure and predictability also play into safety in the telehealth room. It might feel a little counterintuitive, which I thought when I first read this, that consistency and clarity are definitely needed in telehealth because it's less predictable. And that might seem a little, again, counterintuitive, but when you're in an office, you have a script. When you go to your physician's office or go to your therapist's office or your chiropractor's office, you have a script. You know what's going to happen. You're going to check in, you're going to be greeted, you're going to wait, you're going to come back. You kind of know that. You don't even have to think about it if you've been there a couple times. Now, telehealth, even though I'm in the comfort of my own home, I'm safe with my belongings around me, and I'm no different than I was 10 minutes ago. Just the fact I'm logging onto a telehealth session, makes the whole format feel different and feel ambiguous and feel a little scary. So normalizing that and not taking that for granted, that folks who have not had a telehealth session before this is going to feel scary, even though they're very, very safe in their own home, probably safer than they were driving to you. So it's important to keep the structure the same and to explain what's going to happen throughout the session. So I like to start with we're going to cover this X, Y, and Z today. Is there anything else you'd like to add? I like to start the sessions the same way. I also like to put prompts in the middle of the session with timing reminders because I don't know about you guys, but when you're home, sometimes you can lose track of time a little bit easier. So we have 10 minutes left. Is there anything else you want to shift into before we wrap up for today? And last but not least, I also like to use visual cues. And that would be utilizing all of those awesome screen sharing abilities we have. So sharing lab results, sharing forms, watching videos together, really being able to join over one shared experience, even though you're across two screens, is really helpful if you can build that into your structure. So with that, we also have nonverbal cues and communication. So if we have eye contact, we have structure. Now we have the entire session ahead of us. We, as clinicians, need to be very aware of micro moments of connection. These little head nods or gestures or eye movements that often go missing when we're just staring at a screen. If you're sitting one-on-one with someone, I guarantee you, you're probably going to be a lot more in tune with their nonverbals. You're going to be mirroring them more. You're going to be nodding or frowning when they frown, but the screen actually decreases our ability or our natural inclination to do that, I should say, not our ability. We have to be more aware and more purposeful with how we relate and how we use our micro expressions with clients virtually. So nonverbal mirroring plays a critical role in building trust, and so much so that providers who use nonverbal mirroring and named the client's nonverbals were rated as more empathetic as a provider. So we really want to make sure that we are mirroring, and we're also, when we notice our client maybe slouching or sitting up straight, maybe they got really nervous or anxious, we want to name that. Hey, I noticed your posture's changed, or oh, I noticed you paused a little bit longer there. Can you tell me what you were thinking there? Notice the things you might let go in the in-person room, because that's what we have to hang on to. Even if they feel little, it can't hurt but to name it, right? Bring it into the room and see what's there. That is my favorite piece of nonverbal cues, is just naming it and allowing it to be. Because if you do it often enough, your client might do it right back at you. And they could say, "You look a little tired today," or "You're not as you're not as talkative." So it's important, and that is what we're talking about. That's the rapport. That's the relationship. It's not necessarily the medical intervention, but it's the relationship that underlies the medical intervention, the adherence, the compliance, everything else that comes with it. So it's so important to get that right. What we've also learned over the past 5 years is that environmental privacy is quite the hurdle. When we jumped into telehealth, I don't know about you all, but I was sitting at my dining room table with my kids and my babysitter in the basement, and my husband was up in the third floor, and we were just making it work. We were just making it work. We had to adapt fast. But as telehealth becomes part of our long care practice delivery, I mean, it's integrated into most practices now. We need to be aware of the ethical and legal standards and how they're evolving to protect both managing clinical risk and the tech risk that come with unsecure environments. So first, one of the things that I think most surprised me, because I was in breach of it until I learned about this, was the recording devices and smart tech. They are all around our houses, or at least my house, and they're probably all around your client's house too. We're talking like Amazon Alexa, Google Nest, smart TVs. Your watch can do it now. Doorbells, any of these recording devices. And I'm not even talking about the ones that go on your computer, just the ones that are passively listening in the environment. Now, this doesn't necessarily pose a HIPAA threat, because HIPAA focuses on the protective health information on the provider system, the provider's end. But we do have to be aware that we should be warning our clients to be cognizant of anything listening in on their telehealth sessions. So obviously we're going to do, as providers, we're going to make sure we don't have an Alexa in our office, but we definitely want to make sure we note or maybe even put in our informed consent. Please ensure no recording devices or smart assistants are active during our sessions. This is important to one, to help your client understand their privacy, advocate for themselves, but also, I don't know about you, but I don't want my sessions being recorded without my consent either. So it's something that you might want to consider putting in your informed consent, and then also with a verbal privacy check at the beginning of each session if the client is in a new environment. So if you see them every day, every session in their bedroom and they never have any recording devices, but you see them in their living room, definitely check in. Say, hey, you might not be aware, but let's do a quick scan of the room. Are there any recording devices? And again, with those older populations, a lot of well-meaning children or friends set them up with these devices. They might need some assistance in helping them turn it off or unplug. So just be aware this is now in our wheelhouse. This is something we can help our clients with. And environmental privacy is not just about HIPAA and the tech piece, it's also about feeling safe enough to speak. So, like I mentioned earlier, I had everyone in my house segmented on different floors during the pandemic, during our work days. And that was because I wanted everyone to feel safe enough to talk. I wanted to feel safe enough to talk to my clients as if no one were listening. And I wanted my clients to feel safe enough to talk, knowing no one would overhear them either. So it's important to keep our environment safe, but now that we're back in the office, it's more about the client's environment than ours, right? So it's about helping the clients find their safe space because confidentiality breaches were found to be actually, I think this is an underestimate, 3 times more likely when a client attends sessions in open or shared spaces. If you were in my house, that's like 100% chance, like 10 times more likely it's going to be interrupted if we are in a shared space. So at the beginning of the pandemic, a lot of us were very lenient. We were just trying to make it by. But what we're learning is that we really need this privacy. That's why we have private exam rooms. That's why we have offices. That's why we have sound machines. This is an important piece so that the clients can feel safe enough to explore everything they want to with us. Um, so again, this is just a really simple solution of checking in. Is this space private for you today? Also helping them get set up with headphones or even troubleshooting around white noise machines or private space. I know a lot of my clients have taken their sessions in the car. It's not ideal, but it's definitely more ideal than a shared space where they're not being able to speak their truth or speak freely. So keep that in mind, as well as keeping your environment safe. I think that goes without saying. And in high risk cases, this is even more important. If we're talking about instances where there might be severe trauma or domestic abuse, it might be worthwhile having a backup or a secondary asynchronous mode of communication, email, text, anything secure messaging, so that you can communicate if confidentiality is breached and you need to take action that way. So, last but not least on environmental privacy, we have our tech environment, we have our home environment, and now we have our software environment. Because now we have all of these AI and emerging tech fields coming out. And we have everything from note taking to summaries to treatment planning. And in 2023, the US Department of Health and Human Services came out and said that any AI tool using to process or store, so this means it doesn't have to, even if your AI tool doesn't store the information, if it processes it, it still needs to be HIPAA compliant. So that is fabulous for all of us using Jane because I love their voice to chart software. I just did a session right before this and it was easy as pie and everything was integrated. I did not have to download or check anything. It was all HIPAA compliant. But just make sure if you are using any type of summary, note-taking data, you want to make sure you want to look into how the tech is stored, how it's gathered, how it's stored, what is done with it afterwards, and if it's HIPAA compliant. And also your clients also have a right to know if you're using AI in any of those fashions. So make sure you vet it carefully, update your forms so that your clients know what you're using, and revisit your consent as often as you need to keep up with the expanding technologies. So we've come 5 years and we've learned a lot. We've learned that tech is not so scary. Or I should say, telehealth is not so scary. It is quite efficacious, and that it's no longer just a tool for convenience. It's actually transforming how care is delivered. We are having more flexible, client-driven flexible care. We found that, what was the statistic? Here we go. There is a 24% higher treatment adherence when clients have the ability to use telehealth as an option in a flexible hybrid model of healthcare. And it's also used in terms of collaborating across disciplines. I have definitely seen this in mental health care. With virtual care, I have been able to collaborate and been uh, just connected with so many different of my clients' providers so that they have a holistic view of how they're being treated. And I think it's only going to continue. We're only going to be able to connect with each other easier and better as our platforms evolve. So it allows for expanded referral networks, it expands for streamlined referrals, warm handoffs, and all of that improves patient care and patient experience coming from your office. So, what we're finding is that telehealth is not an option, it's not a backup, but it's actually something to integrate purposefully into your practice and use it to stand out among the crowd. Use it as something that you can leverage as opposed to fall back on, because it can be a differentiator, and the stats are there. It's helping people get better. It's helping us serve more people. And we just need to take into account a few different changes as we show up online. So that is what I had prepared for today, on what we've learned. And I'd love to open the conversation up to what's working, what questions we have, and just kind of continue the conversation around telehealth 5 years later. I can't believe it.
This was so amazing, Catherine. Thank you so much. I learned so much. I'm a lover of stats, so thank you so much for digging into that. For our attendees on right now, if you feel comfortable sharing your discipline and your name, you can either drop that in the chat or unmute yourself and join the conversation. And we can kind of start to dig into our collaborative 30-minute. All right, well, I'll share first. Like I said, my name is Jen Drummond. I am a former registered nutritionist and clinical director. So I worked with 7 different disciplines in a large practice in Canada. And we did leverage the use of telehealth for some of our providers to be able to be more accessible to our patient roster. And like Catherine was saying, it really helped to improve patient care delivery as well as adherence to care plans or recommendations of care. And we found it really did transform our practice and just meeting the needs of our community. So it's definitely something that I would recommend to anybody looking to either dive in or optimize their existing structure. Um, so maybe I'll go on here to a question for Catherine as I was listening. But are there different types of either my mind goes to engagement strategies based on age. So for the younger demographic or older patients, do you have any suggestions for keeping them engaged based on age?
Absolutely. I think the toughest demographic to keep engaged, period, is the youngest, right? So those of us looking with the youngest of kids, we know what a challenge it is, and that's going to be as much interaction as you can. And telehealth, I think, lends itself more to that than an in-person office. When I was seeing kids in my office, I had a set of games, I had some crafts, I had some art supplies. But now online, I mean, the world is our oyster. There are so many different types of collaboration platforms and different activities that you can do. So I would encourage you to look into their interest. I know that there's a lot. I'll share this. My son is in therapy, and as we all are, and he is using Minecraft with his therapist. So it's a really, really cool paradigm that we're walking into where we have these virtual spaces. If you can start thinking of them as spaces or yeah, spaces where we can connect over that we can start integrating into our interventions with our clients. So I would say go after their interests first with the young kids. My youngest daughter, she's big into Bluey, so there's a lot of Bluey games on hers. But definitely look into the emerging technology. There's a lot of there's some VR HIPAA compliant VR platforms out there that you can actually engage with kids in a VR world in group and individual formats, but there's a lot out there. I would say open the door and go after your interests because to be fair, like if you don't like Minecraft, are you really going to be able to like ratchet your like of Minecraft up enough to where like a 7-year-old's going to believe it?
Yeah.
So go after what you find interesting and then marry it or merge it with what your clients are doing as well.
Mhm.
For the youngest, I would say the youngest of youngs across all the boards, there's going to be screen fatigue. I think the middle age, the middle adults, the elder millennials, I hate that phrase, elder millennials and Gen X's, these are the folks who might have spent all day already online. So check in with them about what their bandwidth is, how much time they've already spent online, what their connections like, all of that because screen fatigue's real and it's okay to go ahead and turn off your screen and just do audio for a little bit too if you need to look off. Or even say, if you need to look off into the distance and refocus, feel free to do that while you're processing with me or while you're sharing. Like you don't have to look right at me. So just be cognizant of screen fatigue for your clients and what they're coming into the session with, as well as your own screen fatigue. That's big too. Um, so
Well,
go
no,
ahead.
go ahead. Go ahead.
Oh, I was gonna say older adults. I'm very excited about what's coming out there for older adults because there are new technologies. Renaissance RX is one of them. That's out of Lucid. And there's some new technologies coming out to help older adults better utilize technology in their healthcare. So I'll
Hmm.
share this one example of Renaissance RX. And the Renaissance they use bilateral beat stimulation to help calm the nervous system. And so for folks with dementia or Alzheimer's, what they do is it's an online music platform where they listen to music and they infuse it with bilateral beats to help calm down. And then their facial recognitions are read by the camera so that if they're nonverbal, so that the music algorithm can then better play music that they like via their genre or via the decade that they liked or that they were into, if they like country or rap or whatever decade they were into. So there's some really neat technologies coming out for older adults. Um, Again, the biggest hurdle with older adults is just getting them set up. Once we can have that set up and it's part of their routine, efficacy's there. It's there, and they're committed to it, and it's a good thing. It's not something that it's a continual struggle. Once it's set up, it's usually pretty good.
Yeah. Well, and that, just as you're saying it, sounds like something that would be so valuable for um, maybe even children with like
Yeah.
learning challenges or autism who are nonverbal and, maybe they can't make it to an in-person consult.
Yeah. And you know what? Interestingly enough, they're all the research coming out of Renaissance RX is that caregivers are reporting significant decreases in agitation. And
Wow.
unfortunately, right now, I think it's the reason it's older adults is because it was approved for Medicare, but
Mhm.
hopefully we get it for Medicare. Yeah, hopefully we get it for little kids too.
Yeah. Well, and it would just improve that connection because that was going to be my next question was just any, tricks or tips that you have around like building a more personable virtual experience. You touched a little bit about it in your presentation, but I'd love to hear more about your experience there because I think that's what a lot of providers miss. I know I missed it too as a nutritionist, going from being in person to then online through the pandemic. I miss shaking people's hands. I miss seeing them at the front desk and bringing them back to my office. It was a true thing that I I felt lonely. I could
Yeah,
only imagine how they feel. So as you were talking about that in your presentation, I was thinking, oh, I'd love for her to expand on those strategies that would help providers build a more personable experience.
I love that. I love that consideration too, because it telehealth, I was going to touch on this, but I didn't because I could talk forever on this. But telehealth really shifted how some people approach healthcare because it ultimately takes healthcare out of the clinical room, out of that sterile white, doctor's office or therapist's office, which is a little bit more cozy, but still not your living room.
Yeah.
It brings it to your home. It brings it to your comfort zone and to your like we're in my office right now. So like we're in my home. And that is a huge opportunity that is not taken advantage of. You can really use this as a way to bond with clients. In fact, you really kind of have to do more self-disclosure in telehealth than you would in normal one-to-one because it's like a handshake, right? If I tell you, oh, my dog's sleeping right there, or I show you, I pick up, he's sleeping, I wouldn't pick him up, but I show you my dog, that's almost like a virtual handshake. You're showing me someone you love. You're showing me something that is part of your world that you didn't have to.
Yeah.
That is a huge, huge, huge offering from a provider. If we can put ourselves in the patient's shoes, it's really humbling to be able to see your provider as a person who also cares for other things. So I would say use your office as another tool. Like I have so many figurines back here that I can pull from, and my clients know are there. And I would say make it part of the session so that your environment is also their environment. And if it's possible, hopefully their environment can become part of your environment too. If you can help them set up so that they meet with you in a regular place, perhaps they have a regular notebook or they have a regular set of tools or games. I know clinicians who have actually shipped out like in-home therapy boxes, just like with a little coffee mug or something to make it a little bit more personable. But it's really about kind of letting your own guard down and allowing them to see you in whatever manner you feel professionally comfortable.
Mhm.
Because seeing someone one-on-one is going to have you're going to connect much easier. You're going to have a much easier way of trusting, innate trusting, and you actually have to kind of facilitate that or bring that to the surface purposefully in telehealth. And that's with self-disclosure, naming things, being very transparent, and I guess being very real and allowing the hiccups of telehealth to happen because they will.
Yeah, and essentially leading with authenticity is the message here.
Yeah.
Um, and I love that, setting your session up for success and whether that's, sending a little care box or, consents in your intake form or information about what to expect at your first session or how to set yourself up
Hmm.
as a patient is so valuable for them so they don't feel kind of, well, the laundry's not done or my kitchen's a mess and like where do I sit and it's
Huh?
embarrassing to be in my house.
Hmm.
There's more that they have to think about than get in the car and just go to the appointment. So I think to your point, just acknowledging that, like, it's okay. It's okay if the dishes are in the sink. Yeah, I'm here for you, you know?
Hmm.
I
Yeah,
think that's right.
some of the stuff feels so obvious. But when we're in our day-to-day work, like when I am in my therapist mode, I am going. Like I'm on not a treadmill, but I know my path and it's a well-worn path that I'm comfortable with.
Yeah.
And part of this is just about just being aware of the differences and just making a new path for telehealth because it is different. It's fundamentally different to connect via telehealth. Now, the services, the things you might be doing or charting might not be different, but the experience is different. And just being aware of that and purposeful. I think purposeful with it because it could be a leverage. We could leverage this in a big way.
Yeah.
Mhm.
I'm going to stop us here and just see if anybody has questions they want to pop into the chat. If not, I'm gonna continue probing Catherine's brain here. But feel free to add a question or unmute yourself. We are happy to have you join our conversation. I do want to talk about building collaborative relationships across telehealth. I know we talked about, or you talked about that a little bit. Um, but do you have any, best practices for maintaining communication between providers or across disciplines?
Ooh, well, I think that depends on what you're aiming for. I know that, I guess in this presentation, I was thinking more along the lines of consulting and making sure we're on the same page with a shared client.
Yeah.
But telehealth also lends itself well to making really great networking connections across really big distances that you would not normally have access to. So, yeah, I think maybe I'll speak more about the networking piece, Jen, and
Sure.
then is that okay?
Of course.
So I love networking, hence I created a network. I actually used to joke in college that I wish my major was networking, and here I am. But with telehealth, it really opens the door to all of these specialties and these niches that you might want to connect with, or you might want to have in your referral system, or you might want to even just have to refer or to receive referrals from. It opens up all of these niches across locations. So I would definitely say expand your horizon when you're thinking about referral sources or networking. Expand it. I would say don't even think maybe about location unless you're thinking about where you can practice legally, because it really depends on the fit of the connection, right? So I would say reach out to as many clinicians as you feel like you can handle. And most of us in the field, we like to do coffee dates. I don't know, Jen, do you do coffee dates?
In person and online, actually.
Okay, yeah. So one of the big things is doing coffee dates. Yeah, so set up a coffee date with a clinician in a totally different area of you, and just use that as a time to get to know them. I would not say use this as a time to pitch your services
Yeah.
or ask them for things, but really use this as kind of why we're here today, community building. And with community comes referrals. So best practice is just really be authentic and be yourself. Um, be be thankful and be grateful for their time. I would say there's been a couple it's a gift to have someone give you their time to be able to meet with you for coffee. So just be aware of that. And definitely follow up. I don't know if I have a best practice for following up. I want to defer to you, Jen. I follow up as I think of them, which I tend to do quite often. But how do you follow up?
I'll usually follow up the day after, just thanking them for their time, and then depending on what the conversation was about. So, most of the time, we're collaborating on things like this. So, I like to be able to schedule a follow-up call just to go over any questions or concerns that they have if we are looking to collaborate on an actual event, or in this case, if it is like as a referral network, what can I give you as far as a resource to help? Your community, or how can I add value to your community instead of going into the conversation as sales
Yes.
pitchy, what can you give me, more approaching it as what can I do for you? And I think if we network in a way that doesn't always revolve around a need, like what you need, and more what you can give back, it does just help to inspire growth for sure. So following up 24 hours afterwards, and then whatever is indicated within that conversation. That's what I would say.
I love that. That's similarly, and then yeah, and then some colleagues of mine, they like to do like holiday gifts to a lot of their now to their network. And so that's also like if you can think about touch points throughout the year that you want to reach out to maybe all of them, like Physicians Day or Nurses Day or any of those, you can think of those days, and that's also a really nice annual or biannual touch point you can have with all of your network. I
Yeah,
no, I think we should start saying community instead of network because it's really what we're talking about.
it is. It
Yeah.
is. It is about community. And I think that's one thing. Well, that's the theme that keeps on coming back up, regardless of discipline, is we all have our associations, and I think that's wonderful. And typically there's between 1 to 3 to 4 events a year that you can go to in person. But where does that collaborative environment come in on the daily, the weekly, the monthly, like those
Yes.
touch points? And I was very fortunate to work in a multidisciplinary practice where I would go in and have a lot of collaboration, but that is not the norm for a lot of providers. And so you're spot on when it comes to this is about building community. And yes, you're growing your network, but you're also leaning on those that can support you if you have a difficult
Mhm.
time in practice or, whatever is happening in your career life. There's a lot of value to growing community, and that doesn't need to be in your specific geographic location, to your point.
Oh, absolutely. And I can't help but think about how virtual healthcare or virtual care might actually be perpetuating the lack of community problem because you don't need an in-person office now to be able to start a private practice, speaking from the mental health field. That it you are a lot you there's more opportunities to become siloed or isolated. That it yeah, building that virtual community or that community outside is so critical not only to your mental health but to your business health
Mm,
to yeah, just sustainability in general. It's like a double-edged sword, right? It's allowing us to do more by ourselves, but
yeah. Yeah, it takes a little more effort, but anything new is worth exploring. And I think that's the point of this discussion as well, is beyond that little hill of fear exists a lot of opportunity, not just to improve patient care delivery, but also for providers to have more flexibility in their schedules. But if there is a bit of isolation there, it's also on us as providers to build that network in that community. So yeah, I'm aligned with that message for sure. I had a question for you about how you feel telehealth has changed how group practices and solo providers collaborate with other professionals and what
ooh,
you've seen
what I have seen.
or your opinion.
Honestly, therapists have been really good about collaborating before the pandemic. I'm just gonna pat ourselves
Yeah.
on the back. We've been really and nutritionists.
Yes.
Any of those interdisciplinary fields, I think, had the collaboration piece down. What I'm noticing, and I come from the world of primary care, what I'm noticing is it's bigger in primary care and medical and the big medical models. There's a lot more specialty collaborations because telehealth allows that to happen. I'm just thinking back to 2015, so way before the pandemic. I was at Nemours Children's Hospital in their organizational development team, and we were just rolling out a specialist consultation um, like little cart with a screen that we would have cardiologists from our Wilmington location zoom in, or whatever we called it, zoom in to the pediatric hospital down in Jacksonville, Florida, to be able to consult. And that was huge at the time. Like, that's big. And I've only seen that improve and get so much wider. And I mean, my little small town primary care office, we have telehealth specialists chime in. And it's just been amazing to see I come from a very rural community, to see the accessibility of care increase just by consultations. Our primary staff, our primary care providers can treat a lot of what's happening with the consultations of the specialist overseeing them. So it's been pivotal in my hometown community in getting a lot specialty care, widening access to specialty care.
Yeah, that's incredible.
Yeah. So I'm
Um,
seeing it more among, I would say, us independent people. I feel like we're not so bad at collaborating because we had to. What the
right.
biggest change I'm seeing is in the systems.
hmm and I think professions that already consulted one-on-one, that was almost an easier switch to telehealth because I actually opened up my schedule to say you can either come in person or online. Doesn't matter because it's the same type of consult as long as my systems and my intake automations are strong, that one-on-one happens either face to face or online. It
Exactly.
posed a little bit more of a challenge to find a unique way to deliver telehealth for professions like chiropractic and physical therapy, where your hands are on people all the time. So I've had these discussions, I'd say more in the last 2 years with those disciplines to kind of branch out in their plan of care to say, well, would it be clinically indicated for you to have a follow-up virtual call for exercise prescription and see how they're physically doing, but verbally communicate that? And I've
Mhm.
actually seen a lot of PTs online now do full exams via
Oh yeah,
telehealth.
my PT's online. Yep.
Yeah.
hmm
Which
hmm
is wild to me. I
Yep.
mean, that just changes the way that you serve a community that needs you. And I think maybe more along the lines of like PTs that are doing pelvic floor
Mhm. Yes.
rehab post-pregnancy and stuff like that. And I'm thinking, oh my gosh, I probably would have leaned on that provider way more postpartum had I had that option because getting out of the house with a 2-week-old baby, I mean, it just wasn't happening. But I think of all the other individuals and all the other patients that also struggle to leave their house for chronic illnesses or challenges that they actually need the support. But their clinic just doesn't offer telehealth as an option, where these providers that typically would be more hands-on can now maybe change the way they make their recommendations of care and their appointments, progress exams, whatever it may be, um, to just bring that care together for a community that really needs it. So that's where my head goes.
I mean, if we can make the care easier and more accessible, why wouldn't we?
Yeah.
And easy, yeah, yeah, absolutely. That makes me think your postpartum example. I mean, that's the best example you can think of is postpartum mental health check-ins. Are you really going
Mhm.
to ask the mother to come to your office to like a week after giving birth? No, like that's not the best idea. So
Yeah.
yeah, postpartum check-ins and also with little ones. Actually, one of the things when I was at Nemours again, we rolled out was it was one of the first urgent telehealth urgent care sites. And it was wild because parents were eating it up. It was amazing because who wants to drag your toddler at 2 a.m. to an urgent care when you can just hop on the phone and your insurance is there? And it was just, it was a no-brainer. It was a no-brainer. And that was when I was like, oh, this is the future.
Right. And for a safety perspective too, I know if my kiddo has a fever and I want to just make sure everything's okay or I'm following the right protocols, the last thing I want to do is be dragging an immunosuppressed child into a bacteria-ridden hospital or urgent care. I
Yeah.
mean, obviously, if they're really struggling, yes, you get them seen. But there are so many opportunities for people to think creatively on how they can offer virtual care within their discipline. It doesn't need to be the professions that do the one-on-one consulting. I think that's the message I'm trying to get across is that that's where my brain goes as a consultant every time is how can we increase touch points for this patient population that really needs you in a way that's clinically indicated for them and reflects your background. How can we do that?
I love that.
Yeah.
That's yes, absolutely.
Yes. We are almost out of time, but I had one last question, if you don't mind me asking, and this is going to be more about security risks, but what do you think are the biggest security risks providers should be aware of when using telehealth?
Ooh. Secure. Oh God, my brain can go in so many different directions with this. Are we talking liability, clinical? What risks are we talking about? Let me.
Any risks? I mean, whatever you're drawn to talk about.
Yeah, I think. one thing I think I'm going to take this a little bit differently. I think with the emergence of AI, one of the biggest risks there is how our data is being used. And um, I'm all for AI. Maybe not all for it. I like AI. I'm here for it. I like learning about it. I like how to see how it can make work easier and improve our lives. But what I think the biggest risk is using technology without knowing how what's being done with the data. That to me is the biggest risk, and that's also the biggest blind spot among practitioners, I think. If you choose to use any type of third-party software, you really need to be aware of how are they collecting your data? Are
Mhm.
they keeping it anonymous? Are they de-identifying it? Even if they are de-identifying it, what are they doing with that? Because what we're finding is that we can collect, some platforms can collect all of these medical sessions and de-identify them and remain HIPAA compliant, but use all of those sessions for whatever research they want to do, and they don't have to disclose that. So we are, in essence, handing over our work, what we have been trained and what we do, handing it over recorded verbatim to software companies and letting them de-identify it and do it with it what it will. So when you choose third-party software, absolutely make sure look into their ethics, look into their software, look into absolutely everything about them if you can. That's also why I choose Jane to go with chart voice to chart because it's all integrated. I trust Jane. They are not doing anything with the data. And they won't. They said they won't. So
And it's
that's
secure. Yeah,
yeah,
it's
well, yeah.
totally
I mean,
one
all of these
platform.
are secure, but that's
Yeah,
different. You know what I mean? I don't think a provider is going to go use an unsecure. I hope a provider wouldn't go use an unsecure platform. All of these platforms are secure. They're HIPAA compliant, but they can still use your data however they like. That's the
right.
piece I think is the biggest blind spot. When we're talking about maybe not telehealth, but working online in the medical field.
Yeah. That's very valuable information. And I think it's a fear of a lot of providers of, well, I've seen people use outside voice to chart. Well, not even voice to chart, but almost like eavesdropping technology. And then they copy paste their notes into their EMR. And I'm thinking,
Mhm.
you know,
So those are out there. They are technical. A lot of them are HIPAA compliant and
yeah,
legit. But again, they still keep your data and they may de-identify it, but you don't know where that data is going after or like how long it's going to be around. And that to me is not, I'm not comfortable with that just yet.
right.
Don't
Yeah.
know. Yeah,
Well, and we could get deep into this. And it's a bit exciting, but a
it
bit
is.
scary when you talk about how AI will be able to forecast health trends amongst your patient population, but it's based on prior data, you know? So, yeah, I guess the message here is just stick with the platform that you've researched
Yep.
exponentially. Again, we're
Trust is
both
key with platforms. Trust. Yeah.
trust.
Yeah.
Um, and we're both Jane lovers. So definitely having your AI feature integrated is big thumbs up for me. Is there anything else you'd like to add or any other comments for our group here?
No, I guess I just kind of took your frame and just kind of took it where I thought it would be useful, but this is literally just a starting point. There, I just scratched the surface on things I could have talked about.
Yeah.
So, I just encourage everyone to keep an open mind, an open, clear mind, and keep getting excited. And I mean, keep changing and evolving. That's what we're meant to do.
Yeah, I love that message. Well, thank you so much for your time today and your presentation. It was eye-opening and I just loved this hour with you. For everyone
Yeah.
listening, we will have the recording of the webinar. And this was our first virtual meetup session. I'm so proud of us. We will be doing another one April 15th with Dr. Julie Durnan from
Nice.
Ginger Desk. And our session will be all about building collaborative relationships across disciplines in healthcare. She has a really neat background, so I can't wait for people to hear from her. But again, thank you. Thank you to everyone for joining, and we will see you next session.
Thank you, everybody.
Bye.